GEANCO Foundation, in partnership with Anambra State Government, has concluded its first phase of a 3-day training for traditional birth attendants and primary health care workers on COVID-19 safety measures. The training, which kicked off at Northia Primary Health Care Center, Northia, in Jikoka local government area, was also held in Orumba North and Ayamelum local government areas. Correspondent Chibuzo Obidike filed the report.
Healthcare practitioners from the selected council areas were trained on basic knowledge of the global pandemic and effective ways of avoiding the new virus, especially when taking care of infected persons. Speaking, the State Reproductive Health Coordinator, Ministry of Health, Dr. Uju Okoye, said participants were drawn from all the community primary health care centers across the selected council areas, including the traditional birth attendants, to refresh their minds on COVID-19 pandemic to enable them to be vigilant and maintain best practices in line with the WHO guidelines.
The nurses from the primary health centers in Njikoka local government area and some TBAs. TBAs are the traditional birth attendants, people that deliver at home, because our people still patronize them. So it's a mix-up of the people in the health facilities and the TBAs. And we're here to let them know teach them how to use these protective gadgets together with their mama kits that are being shared to them.
The country manager, GEANCO Foundation, Ms. Pascaline Nchedochukwuka, said since the health workers are usually in the forefront of the fight against the deadly coronavirus, the training became imperative to ensure that they are constantly adhering to the laid down precautionary measures of best practices to avoid being victims of the virus while discharging their duties. Ms. Nchedochukwuka observed that most of the community health centers are in short of the basic personal protective equipment, thus the need for donation of hand gloves, sanitizers, hand washing materials, disinfectants, mama's kits, among others, and encourage them to step down the knowledge garnered to every nook and cranny of their various communities.
We are concerned about health of individuals, especially in Nigeria here. Specifically, we are reaching out to health workers today because we know they are at the front line and there is need to remind them not to relax on the precautionary measures that they already know.